COVID-19, which is spread all over the world. Okay, stay tuned. Coronavirus disease outbreak. Stay safe, everyone. What is coronavirus? Coronavirus are a type of virus. There are many different kinds, and some cause disease. A new well-identified type has caused a recent outbreak of respiratory illness now called COVID-19. On February 11, the WHO announced the official name of the disease, COVID-19. The virus that caused that disease is called Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2 for short. When coronavirus started spread, COVID-19 is the disease caused by the new coronavirus that emerged in China in December 2019, and on December 31, 2019, the World Health Organization, or WHO, China office heard the first-time reports of previously unknown virus behind the number of pneumonia cases in Wuhan, a city in eastern China with a population of over 11 million. What started as an epidemic mainly limited to China has now become a truly global pandemic. There have now been over 3.596.142 confirmed cases and 251.781 deaths. According to Johns Hopkins University COVID-19 dashboard, which collects information from national and international health authorities, the disease has been detected in more than 200 countries, the most widespread outbreaks outside of China. In the UK, there have been 190.584 confirmed cases and 28.734 deaths as of May 3. The true number, if infection and death, is likely to be considerably higher. How did COVID-19 start? The disease appears to have originated from a Wuhan seafood market where wild animals, including mammoths, birds, rabbits, bats, and snakes, are traded illegally. Coronavirus are known to jump from animals to humans, so it took the first time people infected with the disease. A group primarily made up of stakeholders from the seafood market contract it from contact with animals. The hunt for the animal source of COVID-19 is still unknown, although there are some strong contenders. A team of virologists at the Wuhan Institute for Virology research a detailed paper showing that the new coronavirus genetic makeup is 96% identical to that of a coronavirus found in bats. While a study published on March 26 August that genetic sequences of coronavirus in pangolins are between 82.5% and 92.4%, similar to the human virus. Some early cases of coronavirus, however, appear to have indicated that the initial routes of human identification may predate the market cases. The Wuhan market was shut down for inspection and cleaning on January 1, but by then it appears that COVID-19 was already starting to spread beyond the market itself. On January 21, the WHO Western Pacific Office said the disease was also being transmitted between human evidence, of which is apparent after medical staff become infected with the virus. How does the coronavirus spread? As of now, researchers know that the new coronavirus is spread through droplets released into the air when infected person coughs or sneezes. The droplets generally don't travel more than a few feet, and they fall to the ground or onto surface. In a few seconds, this is why social and physical distancing is effective in preventing the spread. And responding to the rapid spread, all the leaders of countries around the world have agreed to lock down and country so that the spread is not getting worse. From school being closed, working from home, as well as isolation at home to not traveling until hashtag in Indonesia di rumah aja, who was trending in Indonesia during this quarantine period.
Is my Celine, and now I will explain about what is the coronavirus symptoms. Coronavirus infect the lungs. The two main symptoms are a fever or a dry cough, which can sometimes lead to breathing problems. The cough that we should wear is a new continuous cough. This means coughing a lot for more than an hour or having 3 or more coughing episodes in 24 hours. If you usually have a cough, it may be worse than usual. Fever if your temperature is above 13.7.9 Celsius. This can make you feel warm, cold, or shivery. A sore throat, headache, and diarrhea have also been reported, and a loss of smell and taste may also be a symptom. It takes 5 days on average to start showing the symptoms, but some people will get them much later. The World Health Organization, or WHO, says the incubation period is up to 14 days. April 19, the U.S. Center for Disease Control and Prevention, or CDC, updated its list of the symptoms to look out for. They include: 1 is chill, 2 is repeat shaking with chills, 3 is muscle pain, 4 is headache, 5 is sore throat, and 6 is new loss of taste or smell. Previously, it only detailed fever, cough, and shortness of breath. Now I will explain how to protect yourself from COVID-19 or coronavirus. First is wash your hand often. Wash your hand often with soap and water for at least 20 seconds, especially after you have been in public place or after blowing your nose, coughing, and sneezing. Second is avoid close contact. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and other household member. Third is cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others even you do not feel sick. Everyone should wear a cloth face cover when they have to go out in public. For example, to go to the grocery store or to pick up other necessities. Is cover, cough, and sneeze. If you are in private settings and do not have on your clothes face covering, remember to always cover your mouth and nose with a tissue when you cough or sneezing, or use the inside of your elbow. Fifth is clean and disinfect. Clean and disinfect frequently, touch surface daily. These include tables, doorknobs, light switch, countertops, handles, desks, phones, keyboard, toilet, pockets, and sink. That's it. How to protect yourself from COVID-19 from me. Thank you.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
By now, you've probably heard of COVID-19, or coronavirus disease discovered in 2019, which is responsible for a global pandemic. COVID-19 is caused by SARS-CoV-2, or Severely Acute Respiratory Syndrome Coronavirus 2, because it's genetically similar to the SARS coronavirus, which was responsible for the SARS outbreak in 2002. Now, coronaviruses that circulate among humans are typically benign, and they cause about a quarter of all common cold illnesses. In COVID-19, what happened is that there was a coronavirus circulating among bats, which are a natural animal reservoir, and it mutated just enough to start infecting an intermediate host, the pangolin, an animal that looks like a cross between an anteater and an armadillo. In late 2019, the coronavirus mutated again and started causing disease in humans. The outbreak began in China, but has since spread around the world. As of March 9, 2020, or roughly 3 months into the outbreak, there have been 109,578 confirmed cases of COVID-19 and 3,809 deaths, resulting in a fatality rate of 3.5%. But that represents an average across different countries and timeframes. Based on a large study in China, digging deeper reveals that the fatality rate in China was actually 16% for cases between January 1st and January 10th. But then it fell steadily over time, until it was only 0.8% for patients with symptom onset after February 1st. There are two main reasons for this. First, the hospitals and clinics were initially overwhelmed and couldn't manage the disease, so both patients and healthcare providers were getting severely ill and dying. But within a few weeks, with better equipment, testing, and processes in place, the healthcare system responded and brought down the fatality rate dramatically. Now, as a point of comparison, the flu typically causes a fatality rate of 0.1%. So, even based on this data, COVID-19 is still 8 to 35 times more deadly than the flu. It's also worth pointing out that for COVID-19, the mortality rates differ by group. So, for example, if you split things out by age, you can see from this table that fatality rate is relatively low if you're below 60, with no deaths seen in children 9 and younger. But then it starts to really climb up for the elderly, so they're really the ones at highest risk. Similarly, the fatality rate is higher for folks with hypertension, diabetes, cardiovascular disease, chronic respiratory disease, and cancer, relative to folks without any of these conditions. And of course, a lot of the elderly typically have one or more of these conditions, so it's not surprising that they go hand in hand. Now, although the COVID-19 pandemic is still ongoing, the good news is that in China, and also in South Korea, the number of new cases per day has dropped off, largely due to the aggressive public health measures like quarantining, aggressive testing, and ensuring hospitals have the right equipment and staffing. Based on the current data, over 80% of the patients with COVID-19 have a mild infection, and some people don't develop any symptoms at all. For others, they can develop symptoms that can range from pretty mild, like fever, cough, and shortness of breath, all the way to serious problems, like pneumonia. Severe lung damage can cause acute respiratory distress syndrome, or ARDS, which occurs when the lung inflammation is so severe that fluid builds up around and within the lungs. The severe infection can cause septic shock, which happens when the blood pressure falls dramatically, and the body's organs are starved for oxygen. ARDS and shock are the main cause of death for people with the infection. And again, this is most likely to occur in those over the age of 60, smokers, and people with other medical conditions like heart disease. In addition to causing disease, coronaviruses can spread quickly. Usually, the virus spreads when people cough or sneeze. and tiny droplets containing the virus are released. These droplets can land on another person's mouth, nose, or eyes, and that allows the virus to enter a new person. When a person with COVID-19 travels to a non-affected area, this is called an imported case. If they start spreading the disease to household contacts and those around them, it's called local transmission, since it's usually isolated to a small area and can be easily traced back to the original person. However, when people begin to contract the disease without a clear source, it's called community transmission. To prevent or contain community transmission, some schools and businesses have shut down, and some conferences, sporting events, and other large gatherings have been postponed or canceled. Once a person is infected, symptoms develop about 5 days later. This is called the incubation period. Now, there's debate about how much asymptomatic or pre-symptomatic people, which is to say, folks that are in the incubation period, are spreading the disease. And it may be much more than what we originally thought. Viruses are given a reproductive number, or R0, based on how quickly they spread. And person-to-person transmission has been confirmed both in and outside of China. An R0 of 1 means that an infected person passes it on to one new person. An R0 of 2 means that one person spreads it to 2 new people, and so forth. If the R0 is below 1, the infection peters out. If it's at 1, it stays steady. And if it's above 1, then it continues to spread. The current estimate for COVID-19 is an R0 of 2.2. As a point of comparison, the R0 of the flu virus is about 1.3, so COVID-19 spreads quite a bit more easily. To confirm the diagnosis, a reverse transcription polymerase chain reaction, or RT-PCR test, can be done, which can detect very small amounts of viral RNA. It's worth mentioning, however, that early in the disease, the RT-PCR can often miss the infection altogether, meaning that it's not very sensitive. So, if severe pulmonary disease is suspected, a chest CT should also be done to help detect the presence of viral pneumonia. It's also important to look for other causes of similar symptoms, by doing things, for example, like a quick flu test or a respiratory viral panel to look for alternative causes of the symptoms. Treatment is focused on supportive care, such as providing fluids, oxygen, and ventilatory support for really ill people. There's also early data showing that remdesivir, an antiviral drug previously used against Ebola, can be helpful, and it's being tested in large-scale clinical trials in the US and China. Unfortunately, there's no vaccine currently available to protect against COVID-19. Having said that, there are some being researched, including one that is in clinical trials and will likely be ready by 2021. So, the main goal is to avoid person-to-person transmission. In areas with community transmission, anyone with mild symptoms, regardless of whether they have been diagnosed as having COVID-19 or not, should wear a mask, and they should self-quarantine within their home. If those symptoms worsen, they should call their clinic, or use telemedicine to talk to a clinician. For people with symptoms that live with others, or even with pets, they should self-quarantine in a separate room, and use a separate bathroom if possible. And they should avoid sharing household items like bedding or eating utensils. In fact, there has been a confirmed case of human-to-dog transmission, where COVID-19 went from a person to their pet dog. However, the dog didn't get sick, and there's no evidence that pets can spread this disease or become sick, so it's not necessary to take measures against companion animals. Finally, anyone with symptoms, including children and younger adults, should not attend school, work, or any other in-person gathering, and should avoid travel. Now, for individuals that don't have symptoms but are at higher risk, like those over age 60 and people with a chronic disease, the recommendation is that they also self-quarantine to avoid the chance of getting sick. Self-quarantining requires keeping a few weeks' supply of your medications, groceries, and household items, as well as having an emergency contact person. Coronaviruses don't usually spread over long distances in the air. but they can get flung from one person to another on tiny droplets of saliva when someone's coughing or sneezing. In addition, some strains of coronavirus can survive on surfaces for over a day. With that in mind, if you're a healthy person living in a non-outbreak area, the recommendation is to avoid travel to disease outbreak areas, generally stay away from crowded places, and stay at least 6 feet or 2 meters away from anyone with symptoms. Wearing a surgical mask is not recommended because they're meant to catch droplets from a cough or sneeze going out, rather than preventing you from breathing in the virus. Similarly, wearing an N95 mask is not recommended because they're only meant to be worn by healthcare workers. In addition, cleaning and sterilizing frequently touched surfaces like toilet seats, door handles, phones, and keyboards is also a good idea. As always, careful hand washing is key, and it should be done with soap or alcohol-based hand sanitizers and scrubbing for 20 seconds. Also, avoid touching your eyes, nose, and mouth. This is the area known as your T-zone. It's a common entry point for viruses into the body. For healthcare workers who are around people with COVID-19, the recommendation is to apply droplet and contact precautions. That includes wearing personal protective equipment like a clean, dry surgical mask, gloves, long-sleeved gowns, and eye protections like goggles or a face shield. When performing a procedure that generates aerosol, like tracheal intubation, bronchoscopy, CPR, or non-invasive ventilation, it's important to wear an N95 respirator. This prevents 95% of the small particles, like respiratory droplets, from passing through. Alright, as a quick recap. The SARS-CoV-2 virus causes COVID-19. The virus travels in respiratory droplets and enters the body via the mouth, nose, or eyes. It can cause symptoms like fever, cough, and shortness of breath, and in some people, it can progress to more dangerous complications like pneumonia, ARDS, and shock. The highest risk is among the elderly and those with other serious health conditions. Treatments are focused on supportive care, but medications like remdesivir are in clinical trials, and there's a vaccine in clinical trials as well that will likely be ready by 2021. In the meantime, the best strategy is prevention. This includes careful hand washing, avoiding traveling to disease outbreak areas and crowded places when possible, avoiding touching your T-zone, and if you're a healthcare worker, using personal protective equipment.
Day-to-day symptoms of COVID-19. Before proceeding, please note that this general overview is compiled for initial self-assessment only and may vary for each individual. If you are not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.